Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we have a special guest today. His name is Dr. Eric Arzubi, and he is a psychiatrist. And I don't know if you have ever wondered what the difference between a psychiatrist and a psychologist and a therapist and a pediatrician are, but Dr. Arzubi is going to help us break down what psychiatrists do, when they're needed, and what the difference is in them and the rest of the professionals and physicians that are helping us out. With that, let's get to Dr. Arzubi.
Thank you. Thanks for having me.
Yeah, absolutely. So will you tell us a little bit about yourself? We know you're a psychiatrist, but can you tell us a little bit about your story?
Sure. Well, as I was telling you, my route to psychiatry was a little bit circuitous, to say the least. I think I had probably an early midlife crisis, I would say. I was around 29 years old, and I had spent 6 years in New York City on Wall Street doing finance. And before that, I spent 2 years in Argentina, actually, as a reporter for Bloomberg. But anyway, while I was in New York City doing my work in finance, life was good. I was having fun, making good money, traveling a lot. But I still found myself really unhappy. And every time I reflected on that, I just felt empty at the end of the day. And I got really scared about imagining myself at 70 years old and having spent my life buying and selling financial instruments. And so I started looking and thinking about a role model. And the person I kept going back to was my pediatrician in Vermont, who was my childhood pediatrician. And I grew up in Vermont, and I went back to visit him a couple of times, like in 1998, 1999, when I was trying to make my decision. And one day I finally did it and had to, left work to start. I had to go back and do all my pre-med classes. So I spent a couple of years doing my pre-med classes, and then started medical school in 2003, and then finished all my training by 2015. I did my medical school, my general psychiatry residency, and my child psychiatry fellowship all at Yale. And that was an adventure on its own. During that time, I got married. We had two children, they're twin girls who are actually going to college this year. And also during that time, I uncovered, severe anxiety, which was something I struggled with and actually caused me to delay my training for a year because it was pretty crippling and I had to figure out kind of how to manage it. And so I'm sure that had a role in my decision to become a psychiatrist. I also, during that time, I spent, probably like 8 years tutoring kids in math, science, and eventually some kids with learning disabilities. And I fell in love with the work with children and families. And so I think that's why I landed on child psychiatry. And then in 2013, we moved to Montana on a whim, really. Saw an email looking for a psychiatrist in Montana. We came out and visited. Thought this is pretty cool. It's kind of nice. And I wanted a different lifestyle for my girls, something maybe not as intense as the Northeast. And we gave it a shot. And here we are. 11 years later, I'm still here.
Yeah, that's lovely. What an amazing story. It's amazing how life takes us on this journey. And oftentimes we end up in a place we never imagined, but it's so great.
Yeah, no, it's like I tell people, I have every year I have a different 5-year plan, and it's still happening for me.
Yeah, I love that. Okay, so can you tell us, what is psychiatry? What is the specialty that you have?
Sure. So, as you know, just as well as I do, in mental health, there are lots of different, it's like an alphabet soup of different professionals, right? You have licensed clinical social workers, you have licensed clinical professional counselors, you have psychologists, you have PhD psychologists, and you have PsyD psychologists, you have LACs, licensed addiction counselor. And then you have MDs and you have DOs. And so, again, I know this can be overwhelming for parents who are especially looking for help for their children. And so here's what a psychiatrist is. So a psychiatrist has to go to medical school. So before anything, a psychiatrist has to do all their pre-med work and then go into medical school and graduate with an MD. That's for allopathic medicine, and DO if they do osteopathic medicine. Either way, they're both medical school, okay? After medical school, we decide, or right towards the end of medical school, we decide what specialty we want to go into after medical school, right? So every single doctor has to finish medical school. Then we specialize in surgery, pediatrics, neurology, psychiatry, right? So that's when all the training happens to specialize. So in my case, well, a general psychiatrist, so a general adult psychiatrist, will do 4 years of training after medical school. Then after that, people can go even specialize further into like forensic psychiatry, geriatric psychiatry, integrated psychiatry, which works at the intersection of physical health and mental health. And then there's child psychiatry, which is what I did. So it's another 2 years of training to subspecialize in child psychiatry. And so during psychiatry training, the training is pretty comprehensive. And because we're doctors first, we have a pretty strong understanding of the biology, the neurobiology, biochemistry of the entire body, including the brain. We are taught about how medications can help and hurt people. Again, going down to the very fundamentals of medications, their impacts on the body, and also understanding what, let's say, non-psychiatric medications and how they can impact people's mental health, because a lot of times people might struggle with the side effects of a medication they're taking for some other ailment. And so we're physicians first, and have a really strong understanding of the neurobiology and the biochemistry and the physiology of the entire body, including the brain. Add to that, think about, for the case of child psychiatry, what I did was I did something called fast track. So I did 3 years of adult and 2 years of child. So it was 5 years of training after medical school. So if imagine that, it's basically 5 years. Each year I get, let's say, 4 weeks off, but the rest of that time it's 40 hours a week at least for 48 weeks a year of doing clinical work in a hospital, in a psychiatric hospital, in a medical hospital. We do 6 months of neurology. We do 6 months of internal medicine. And during our psychiatry specialization, we actually, and this maybe not everybody appreciates or knows this, is we get tons of training on psychotherapy. We're trained to do psychodynamic psychotherapy, which is the kind where people lie on couches and stare at the ceiling and come in every day. We do cognitive behavioral therapy, dialectical behavioral therapy, interpersonal therapy, motivational interviewing. We're exposed to all these therapies. Unfortunately, the healthcare system is such that there aren't enough of us. And thankfully, we have a lot of therapists out there. But we psychiatrists, we love actually just the conversational part and the therapeutic relationship with the patient. We love that. And we all love the psychotherapy part of this. So we weren't trained to just do medication management. We were trained to think about the entire person, being more holistic. But the healthcare system has pigeonholed us into being the folks that do medication management. And a lot of us don't love that. And so anyway, so that's a lot of the background, but that's how psychiatry is, how psychiatrists are trained.
Yeah, that's really cool to understand all that you guys go through to be in this place. So you're experts in mental health and also how medications work in our bodies and the side effects and those kind of things. So I think this may be self-explanatory, but can you explain the difference between maybe a psychologist, because I think oftentimes psychology and psychiatry get confused. What are therapists or psychologists doing that is different than psychiatrists?
Sure. So it depends on the psychologist. So psychologists can go through a bunch of different tracks to get trained. So there are PhD psychologists and there are what's called PsyD psychologists, which means they get doctorates in psychotherapy. I believe that's what PsyD stands for, and I'm sure I'm going to get a psychologist that yells at me, but there's PsyD and PhD. The folks that do PhD, I believe because they're both doctorates, they both end up doing a research, they have to do a research sort of capstone and thesis. But the folks on the PhD side tend to be more, the way I think about it, and again, you'll have to talk to psychologists who'll know the nuances better than I. But many of those psychologists they can be very technical, but we'll also go and get psychotherapy training. So there are lots of PhDs who are, wonderful therapists. But when you hear about people getting psychological testing or neuropsych testing, those are often also the PhDs who really get into the weeds in terms of doing extensive testing that includes looking at personality, cognitive abilities, IQ, personality, and so forth. But again, PhDs can do psychotherapy as well. And then you have the PsyDs who tend to do more, or those are the ones that tend to focus more on the clinical work. But in some, you have, psychologists who have those two different degrees, both of whom can do psychotherapy and many of whom have been well trained to do psychotherapy. They are not physicians first, though. They're not physicians first, right? They're psychologists. They don't go to medical school. They go from undergrad to their psychology program, and they learn a ton about, depending on how technical their program is, but they learn a lot about the neurobiology of the brain, how the brain works. But they're not experts in sort of the entire body, nor on how medications work, the side effects or the benefits of medications. And that actually brings me to a comment. Sorry, Bryce, I'm answering your questions in a really long way.
No, you're okay.
One of the things that I run into sometimes is people getting out of their lane, having psychologists or other counselors and therapists making medication recommendations to parents. And that can be confusing for them. Again, I'm not saying all psychiatrists are perfect and we all know everything and we're perfect. Not at all. But I feel sometimes it can get confusing for parents when a therapist will say, "Oh, Dr. Arzubi, prescribed that. I don't like that medication." Well, that's kind of a little bit out of somebody's lane. What I would prefer, if that therapist reached out to me and say, "Hey, Dr. Arzubi, why did you prescribe that? Can you help me understand?" But anyway, that's just sort of an aside.
Yeah, no, it is a good point to make of therapists and psychologists are not physicians, and we may have the name doctor in our title, but we are not physicians. And so that medication portion is limited to somebody who is a physician or nurse practitioner who's gone to school specifically for those types of knowledge and baseline things. So what do you think the role of psychiatry is in people's lives?
So I think it's evolving. Again, 30, 40 years ago, the psychiatrist did more psychotherapy. Again, because we're well trained in psychotherapy and we enjoy it. And again, I would, a good psychiatrist won't jump immediately to medications. So what I'm going to do is I'm going to talk to you a little bit about my opinion on what a good psychiatrist is. Again, that's my opinion. People may or may not agree, but a good psychiatrist will continue to keep those different hats on in terms of the holistic approach, understanding what kind of psychotherapy might be beneficial, and think of that as a first line, and then medication as a second line, thinking about what other supports there might be in a person's life that can kind of lift that person, add more kind of protective factors for that person to mitigate mental health symptoms. But really not always starting with medication first. And because again, so number one, that's the way it should be. Number two, families, parents, I would encourage parents, if a psychiatrist, after just a brief initial meeting, recommends medication, ask about it and ask multiple questions. Because unfortunately in healthcare, the reality is you have to advocate for yourself and you have to advocate for your child. So it's okay to be skeptical. We psychiatrists, we physicians, we're just human. And the way I think about it, and what I tell my patients is, I'm just a consultant. You don't have to do what I tell you. Not at all. I'm a consultant. I'm going to give you my opinion on what I think could be helpful. I'm going to try to give you the pros and the cons of an intervention. And then ultimately you decide, and you have total control. So I want parents to understand that they remain in control. Just because they go to see a psychiatrist or physician, you're not giving up control, nor should you. You should continue to advocate for yourself and ask probing questions, because this is your life and this is your child's life. So by all means, feel free to question, feel free to get second opinions. A good psychiatrist won't have their feelings hurt if you say, hey, I want a second opinion. If their feelings are hurt, it's not the right psychiatrist. So I really encourage that. So that's a little bit of an answer, but like I said, the role of a psychiatrist is evolving. Again, different than it was 30, 40 years ago. Right now, because of the way the healthcare system works, what it incentivizes, and the fact that there are so few psychiatrists, we often end up playing the role of doing an assessment, helping with diagnosis, and then helping formulate a treatment plan, which sometimes helps with and includes medication management. Sure. The way I think about it, the physicians in our communities, primary care are often the front lines when it comes to mental health, because those are the doctors that you see most often. They can be very good at helping with mild to moderate mental illness or addiction problems. But when it comes to moderate to severe addiction problems or mental health issues, that's really when it's good to include a psychiatrist, because, again, we have the most training out of any healthcare professional to be able to help in that way, to help with the diagnosis, treatment plan, and then interventions.
Yeah. And so, I mean, that's good, because not everybody needs a psychiatrist, right? And
No.
Just because you have anxiety doesn't mean that your primary care or your pediatrician could not manage that. It's more like if it gets beyond what they feel comfortable with. Sometimes physicians will say, this is out of my area of comfort. So I think that's fair for them to refer to a psychiatrist who's an expert in that. But then also, if it just seems like there's a lot going on or we're not getting better, I know in therapy, like I love doctors who don't give medications right away, because a lot of times therapy and working on the dynamic of what we can identify and changing behaviors and changing how parents respond to things can totally transform how a family or a kid looks. But there are times where medication is needed. Can you talk about what your thoughts are around when we might need a psychiatrist for managing mental illness or a mental health diagnosis?
So the times when it's appropriate to have medication?
Yes. Yeah.
Yeah, again, I would say when it's when you're talking about moderate to severe mental illness. So I can talk a little bit about that. Excuse me. So about 20% of the population, of the entire population, has a diagnosable mental health problem at any time. And not all 20% know it. And so really about half of those people end up looking for care. And out of that chunk of people looking for care, there's I'm gonna kind of give you an estimate here, but 80% are mild to moderate in terms of their the severity of illness, and 20% are severely mentally ill. And with a severely mentally ill, I'm talking things like bipolar disorder, schizophrenia, schizoaffective disorder. The really, really severe stuff. And also you can look at, and people have severe major depressive disorder, severe anxiety, and so forth. Every DSM diagnosis, every DSM-5 now diagnosis includes a criteria that says impairment in functioning. And so the way I think about it is, if the impairment in functioning is mild, so again, doesn't alter the way you go through. Let's talk about children. Mild impairment functioning might be difficulty falling asleep, but they fall asleep. Some irritability, but they're okay. Like it doesn't really get in the way of being able to kind of complete schoolwork, finish the school day, right? Because the two biggest jobs a child has is really their school and home, right? And obviously there are other things. They have hobbies and sports and things, but you kind of look at how are they functioning in each one of those areas. As the problems become more significant, you're going from mild to moderate to severe. That's when you start thinking, okay, if I started with providing, just psychotherapy when it's mild or moderate, a lot of times things can get better without medications. But sometimes when you're looking at moderate illness and severe illness, therapy alone will not do it. And so at that point, you have to introduce medications. Now, I try my hardest to make sure that any time, and our team does, we try our hardest to make sure that people taking medication are also getting psychotherapy, because the reality is psychotherapy is great. Medication management can be very helpful, but it is most helpful when it is accompanied by psychotherapy that starts building other types of skills and really resilience in the patient.
Yeah, absolutely. And I'm sorry, you're going to say something.
No, and I guess, there's a lot. I mean, obviously, there's a lot more I can go into about medications. I mean, there are the different types of medications. There's, a couple different kind of common things that tend to come up. Like, parents often say to me, if I prescribe medication, their child has never been on medication before, the parent might say, Dr. Arzubi, I don't want my child to be a zombie. And, and I'll tell the family, I've not created many zombies in my life, and I don't plan to start. So no, I hear you. I joke about it a little bit, but medications in the end, if you're a parent who's advocating for your child and you're working with a psychiatrist who's good and reasonable, working together on finding the right medication shouldn't be a problem. I mean, it's not always easy to do, but parents, I still make sure that parents know that they have a lot of control. Mm-hmm. There are very few medications I can think of that if, mom decides or dad decides one day, you know what, boy, my child is really struggling, is making things worse. You can stop the medication, but then call your psychiatrist to just let them know. So there are very few medications where if you stop it, things, will unravel. Because in the end, the most important thing is that I want families to feel empowered. I want a child, if we're talking about child patients here, a child to take a medication only if it provides benefit, right? Because if the child doesn't feel it provides benefit and they're feeling worse on it, and the family isn't entirely sure if it's really beneficial, then there's no reason to continue that medication. And that needs to be a conversation that's patient-centered, family-centered. And again, we're consultants, and our job is to consult and provide advice. But really, the family and the child are the one who need to decide ultimately.
Yeah, I think it can be really scary. I oftentimes in my practice, if I suggest medication management, will find that parents are nervous about that. They say the same thing. I don't want my kid to be a zombie, or I don't want them to lose who they are. And I'm like, that's not the goal here, right? Like, this is to help. It should be a support. And if it's not, then we don't have to do it, right? Like, let's go to the expert, find out what they think is reasonable, and see what they have to say and see if you like that. If you feel like that makes sense based on your child, then let's go for it. If it doesn't, then, notate that to them, let them know. But also, you don't have to do it. I always tell kids, like, you can leave and not have a prescription for anything. That would be okay. Like, that's totally okay, right? It's up to you. But I think we also have to be thoughtful. I think parents are very afraid of their kids being something different. But ADHD is one of those things where I find that parents are very worried about that too. And they're like, I don't want them to lose who they are. And the thing for me is, I'm like, I'm okay with skills for ADHD and management around that and being supported at school. But when their confidence starts being impacted because they're being redirected, 25 more times than every other kid in the class, that starts to get at who they are, like their soul, right? And that can make them not like school. And what a unfortunate turn of events to not enjoy school. We have a lot of time to be in school, and to not like it and to remove yourself or be distracted where you're not learning, that really negatively impacts kids. So medications can be so helpful to helping kids and adults to navigate life.
100%. And I think you said it very, very well. I tell my families, the families I care for and the children, I'll tell them, I take medication for anxiety, and and I'll share when appropriate. I mean, I don't go around telling people just for the heck of telling people, but when it's appropriate and there's some doubts, I'll tell the child and the mom, say, look, I take medication for anxiety, and did it change who I am? I don't know. I went from being somebody that's like super, super anxious to someone who's less anxious. So did it change who I am? Yeah, thank goodness, because I was really anxious before. And so it doesn't, again, in my experience, I've yet to prescribe a medication where it changes who somebody is. But I understand where that comes from, because, what we're treating here is mental illness. And so there's a lot of stigma around it, a lot of misunderstanding around what that means. But also, who are we? We are who we think we are, right? We are who we think we are. And so what we're terrified of is taking something that changes how we think. Because if we change how we think, does that mean we'll change how we think about ourselves, which then changes our identity, right? That's where that fear comes from. And so, what I try to share with my families and the children I care for and the patients I care for is, I've not yet run into a situation where it changes who someone is. Somebody's soul, remains the same soul. Their values are the same. They don't change. Now, there are side effects to medications, and we want to make sure that the good outweighs the bad. And so, to your point, let's say the ADHD piece here is, ADHD medication, when you identify ADHD, and it's true ADHD, and you treat it appropriately, it can be a game changer. It can be an absolute game changer. And so let's say you have a situation where you have that benefit, but one of the side effects is decreased appetite. So now what you have to do is, as a parent who's advocating for your child, is you need to think about, okay, what's the benefit I'm getting out of this? You say, okay, better attention, better functioning in school, doing better at home, finishing homework, and then decreased appetite. Again, I would hate for my child to have any side effect, but then how do you manage that side effect? So are there other ways to get calories into your child? Maybe, once the medication runs out, you provide some, protein shakes at the end of the day, or you try to provide a big breakfast before taking the stimulant in the morning. Working with your pediatrician, like great pediatricians have other strategies. So again, it's managing that. And the other thing I try to counsel patients and families around is, there are side effects to having anxiety. There are side effects to having ADHD. And sometimes there are side effects to medication. So you can decide what side effects are you okay, which side effects can you tolerate? Are you willing to tolerate the side effects from anxiety and ADHD, or how about tolerating the side effects from medication? Again, the answer is different for everybody, but I think laying it out in a way that, here's all the information, you have the choice, and you still have the control.
Yes, I love that. I love the presenting the side effects of just like normal functioning with a diagnosis as a side effect. There are side effects, like with anxiety, of like not being able to go to a sleepover, but you really want to go to a sleepover, or not being able to go to a birthday party, or not being able to walk into school. Those things can be debilitating and also impact how you view yourself. So that is such a good reframe. I love that. And I think oftentimes parents and anybody can get stuck not thinking about what the side effects of where we are right now are, and how something could benefit us to bring us up. And I think you pointed out a very important point earlier of like, you can stop medication, right? So just because we start it doesn't mean that we're on it forever. And I have parents say that to me, like, well, I don't want to start medication because they might have to take this for their whole life. And my reframe to that is, if we start medication and your kid is feeling successful and likes how life is going, do you really want to take that tool away from them? And they're like, oh no, like that's not actually what I want to do. But it's so worried about the future. And it's like, let's not worry about, that's what, fear is, the fear of future pain. It's like, well, let's deal with that when we're there. Right now, this is okay. We're in an okay spot, and this feels good for your kid, and it feels good for you, and you're getting along with your kid, and the harmony in your house, like there's happiness, and you're laughing again, and joy, and you're like, there's just what we imagine parenting to be, right? Not always, but like it can help do that much of a transformation. So I love that reframe. Thank you for that. So in your many years of being a psychiatrist now, what do you feel like you've learned about parenting, mental illness that you want to share with people?
Great question. So, and Bryce, before I answer that, you brought up something really important that I wanted to reflect on, if it's okay.
Yeah.
as you were talking about, the potential of a parent saying, gosh, I don't want my child to be on medication forever. One of the things I want to caution parents is if you agree that your child be on a medication, you decided that's the right thing for your child, don't share your anxiety about the medication with your child, because it's going to make it less likely for the medication to work, and it's going to make it less likely your child will want to take the medication, right? So if let's say you say, great, we're going to start, on 10 milligrams of Ritalin to try the ADHD, to see if it helps with ADHD. If you're going around, feeling super anxious every time you get like, oh, okay, you're going to take this. Gosh, I hope it doesn't screw you up. I hope it doesn't mess you up. If you're anxious when you're giving your child the medication, your child's going to feel that. And your child's going to feel uncomfortable and not entirely sure that this is the right thing. So I guess I'm just begging parents to, and trust me, I have a hard time hiding my own anxiety when my girls come and tell me things, and I need to act like, I'm cool with things. Like I got a poker face. So I'm just inviting, have poker face when you're giving your child this medication, and let them and their body decide if it's the right thing or not, rather than, again, we all have biases and preconceived notions, but don't let that influence the benefit or non-benefit of the medication. Let's see what the medication does. Try not to kind of push it in one direction or another, if that makes sense.
Yeah, absolutely. I love that idea. I know that we have ADHD in our house, and when, like, if it's a morning and it's getting chaotic and we maybe haven't given meds yet, one of my kids who has ADHD will be like, hey, I haven't had my meds yet. Right. Because it makes them feel better. And I think that's the part, is like they want to feel better. And so that's an important piece of supporting our kids, is also to give them the tools. And this is just a tool, right? It's not that your kid is broken or anything is wrong with them. It's just the way that their brain was made and the way that their body is processing through things. And it's just another tool in their toolbox.
And knowing that mom is okay with the child taking the medication is important. Like they need to have that reassurance and the validation that it's okay. Mm-hmm. So anyway, I just thank you. You triggered that thought, and I thought it was an important point to bring up.
Yeah, absolutely.
But back to your question about sort of what I learned over the years, so right now what I'm doing, when I moved to Montana in 2013, I worked with a big health system for 6 years. And then in late 2019, early 2020, I started with my partner. His name is Dr. Reza Hosseini Gomi. We started an all virtual, telehealth practice called Frontier Psychiatry. And, we still have that practice. Right now we're serving all 56 counties in Montana. We just expanded into Idaho, and we're going to be expanding into Alaska later this year. And the reason I'm bringing that up is, it's a shameless plug, I know. But on the other hand, but I'm bringing this up because I'm in a situation where, when I came here, I didn't know that rural America, again, that's not something I teach you. Rural America is really struggling with a very severe mental health crisis, a lot of which has to do with lack of access to care, right? So if you're in a small town in Montana, Idaho, or Alaska, you're not going to have access to psychiatrists. And so one of the things that I've learned over the years as a psychiatrist is that we need to completely rethink the way we deliver mental health care. We have a problem nationally, okay? And the idea of a mental health crisis has been in the headlines in our country for the last, 20, 25 years. It's no longer a crisis. This is the sad state of the new normal. And the only way we're going to dig out of this is if we completely rethink the way we do things. We need to change the way we train psychiatrists. Psychiatrists need to do a better job getting creative at how to deliver care, getting creative about how to collaborate with primary care and therapists. We need to embrace innovation. We are never going to have enough psychiatrists to really solve the many problems we have in our health system. And so we need to get better at really being creative and taking what we know and disseminating it as widely as possible. So it goes a little bit back to what you were saying, in terms of the role of psychiatrists. It's going to continue to evolve, I hope. I'm going to do what I can to push in that direction, but we need to be accountable, right? Because this is happening under our watch. This crisis that we have, or this new normal we have, this happened under our watch. We own part of this. So then we should also own part of the solution, right? Because what I don't want is 10 years from now being on a podcast or reading in articles and saying, yeah, boy, we got a mental health problem. Like there shouldn't be an excuse for that. So anyway, that's a little bit of my soapbox, but right now I'm all about access to high quality care, and using any tool we have to really leverage that and get it out to the people who need it most. Why should a child in a small village in Alaska have different quality of care than someone who lives in, I don't know, Minneapolis? Why? That shouldn't happen. And so that's what I'm trying to do now with Frontier Psychiatry, but it's also what I still teach at Yale, and I have the privilege of teaching a class on professional development, and I try to mentor as much as possible to think differently about these problems.
Yeah. I love this. I mean, we have a problem with therapists too, although there are more of us than you in terms of psychiatrists. But I mean, not every therapist is created the same. And there are therapists who have unique sets of skills that need to be out there and able to get that information or that resource or that support to different families. And so we're limited by the state boards too. And there's so many limitations and barriers in treatment. But I agree with you that something has to change and we need to be part of that change agent.
100%. Now, and again, I appreciate you doing work like this and having a podcast to kind of continue to push information out there. The more we can do that, and the more we can challenge our colleagues in mental health to do things differently, I think the better.
Yeah. So what do you want parents to take away from this conversation? We kind of downloaded a lot of different things. And so what do you want them to really focus on? Sure.
A couple of things. Number one, stay hopeful. There are good people out there doing good work, and so definitely not to lose hope. Number one. Number two, you are your child's best advocate, and so feel free to question the mental health professionals you work with. And if those professionals feel slighted or hurt their feelings, that's their problem, not yours. Because in the end, you're the mom or the dad, and the child is living with you. So be that advocate. Your child deserves it. Number three, not all psychiatrists and psychiatrists in general don't necessarily love to prescribe medication first. And that's not what we're trained to do. We're trained to prescribe medication if needed, consider us consultants, use us as consultants, but we're not the end all be all. And you don't have to do everything we tell you, but use the information we have, because we have a lot of good information, I think. And then finally, as parents, and this is, I've screwed up enough to kind of learn from my own mistakes as a parent, is I think really I invite parents to be very curious, right? This is hard as a parent, because keep in mind, and you said this at the top, Bryce, that, no child is born with a manual. We don't have the training to be parents. And so we're kind of basing this on kind of our own experience as children and bringing some of that with us, which isn't always awesome, right? So I guess what I'm inviting people to do is see if you can put your own bias about children or your child aside, be genuinely and authentically curious about your child, curious about who they are and who they're becoming. Don't judge that, and validate as much as possible. I think we can do better also, instead of kind of encouraging your child to, encourage your child to be who they are, and don't try to shape who they are, because they are becoming who they are on their own. And I think if we can be sort of bystanders who are supportive, loving, and caring, I think we'll be having great humans that we can share the rest of our lives with.
Yeah, that's lovely. Thank you so much for your time today. This has been such a great conversation.
Thank you very much for your time, and thanks for what you do.
Thanks again, Dr. Arzubi. That was really great information. I know that I learned some things in this episode, and I hope you did too. I hope that now you understand the difference between what psychiatrists are and psychologists and therapists are, and also the role that they can play in our lives and how important they are. With that, I will say thank you so much for your time today. Please like and subscribe to our show. Give us a rating, follow us on Facebook and Instagram and YouTube, and also keep the emails coming with podcast topic suggestions to accidentalexperts@gmail.com. Have a wonderful day.
Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.